Atlas of Virtual Surgical Planning and 3D Printing for Cranio-Maxillo-Facial Surgery was edited by Alessandro and Massimo Robiony. The book was published in 2025 by Springer Nature Switzerland. It is a specialist atlas of cranio-maxillofacial and oral and maxillofacial surgery, focusing on virtual surgical planning, three-dimensional printing, and patient-specific implants. It is intended primarily for specialists and residents in maxillofacial surgery, but it is also useful for oral surgeons, radiologists, biomedical engineers, and university educators. For dental students, it represents advanced supplementary reading. The book addresses a practical problem: how to transform complex anatomy and radiologic data into a precise surgical plan and reliably transfer that plan to the operating room. It therefore follows the entire digital workflow, from imaging and segmentation to surgical guides, implants, navigation, and outcome assessment. The organization is one of the book's greatest strengths. The first part covers software, radiologic protocols, printing technologies, point-of-care laboratories, regulation, patient-specific implants, augmented reality, and artificial intelligence. The second part moves on to atrophic jaws, cranial reconstruction, the frontal sinus and skull base, craniofacial and orbital surgery, orthognathic surgery, the temporomandibular joint, trauma, oncology, midface and mandibular reconstruction, panfacial procedures, and face transplantation. The sequence is didactically effective, progressing from technology to clinical application. The scientific value is high for an atlas, although the level of evidence is uneven. The bibliographies include systematic reviews, meta-analyses, prospective studies, randomized trials, and publications from 2024 and 2025. Nevertheless, a substantial proportion of the operative chapters combine published evidence with author experience and case presentations. Technical elegance should therefore not be confused with proof of universal superiority. This is particularly important when the introductory chapter describes virtual surgical planning as a new standard of care and attributes to it reduced risk, fewer complications, greater accuracy, shorter operative time, and improved functional and aesthetic outcomes. Independent systematic reviews generally confirm greater accuracy, particularly in orthognathic surgery, but they do not support every claimed benefit with equal strength. A more recent meta-analysis indicates that reductions in operative time are not consistently statistically significant. The claim of universal superiority is therefore stronger than the evidence currently available. The first important clinical message is that the quality of a virtual plan depends on the quality of the input data. The authors emphasize standardized imaging, artifact control, precise segmentation, and accurate registration of different data sources. Cone beam computed tomography offers advantages for osseous and dentoalveolar structures, whereas magnetic resonance imaging is important for soft tissues. Automated segmentation is appropriately not presented as a complete substitute for professional supervision. A second important recommendation concerns transfer of the plan to the operative field. Simulation alone is not enough. Its value increases when the plan is transferred using patient-specific guides, predetermined screw positions, plates, implants, or navigation. In orthognathic surgery, the book cites randomized studies comparing patient-specific guides and osteosynthesis with conventional procedures. Independent literature from 2025 also supports greater geometric accuracy with digital planning, although the benefit is not identical for every parameter. A more accurate bone position should therefore not automatically be equated with a better long-term functional outcome. A third clinically important area is mandibular reconstruction. The authors present the free vascularized fibula graft as the principal reconstructive option because of the amount of available bone, the possibility of segmentation, and subsequent implant-supported rehabilitation. Patient-specific titanium prostheses are considered selectively, particularly when the aim is to shorten operative time or avoid donor site morbidity. Particularly valuable is a case presentation in which the plan had to be modified because of disease progression between imaging and surgery. This illustrates an important limitation of digital surgery. A virtual plan may be technically perfect and still become clinically inappropriate if the disease process or anatomy changes. A fourth recommendation concerns the development of in-hospital laboratories for three-dimensional planning and printing. Their advantages include greater process control, rapid modification of the plan, and direct collaboration between surgeons and engineers, particularly in complex cases. However, the book also discusses the cost of equipment, the need for trained personnel, data protection requirements, and regulatory obligations, meaning that this model is not realistic for every institution. There is also a specific regulatory inaccuracy. The introductory chapter refers to the approval of medical software by the United States Food and Drug Administration and the European Medicines Agency within the context of European regulation. The European pathway is not analogous to the American one. The European Medicines Agency does not have a general role as the authority responsible for approving medical devices. Rather, conformity within the European Union is assessed through the regulatory framework involving competent authorities, notified bodies, and the European conformity marking system. This is a good reason to verify regulatory details using current primary source documents. The chapters on augmented reality and artificial intelligence should be read more cautiously than those addressing already established digital planning. Promising results are presented from phantom studies, cadaver studies, and smaller clinical series, but the book itself acknowledges that some applications require further clinical validation. These technologies should therefore be regarded as aids to the surgeon rather than substitutes for clinical judgment. The book's greatest strengths include its exceptionally broad presentation of the entire digital workflow, allowing the surgeon to understand where an error may arise before it reaches the operating room. Its rich visual documentation, including radiologic reconstructions, segmentations, guides, implants, and postoperative comparisons. Its integration of surgery with engineering, manufacturing, quality control, and regulation. Its range from orthognathic and trauma procedures to complex reconstructions and face transplantation. And its open discussion of limitations, including cost, changes in anatomy between planning and surgery, and the fact that a virtual plan cannot replace intraoperative judgment. The principal weaknesses are the uneven level of clinical evidence, occasionally overly strong language regarding the superiority of new technologies, rapid obsolescence of information related to software, artificial intelligence, and regulation, and the limited applicability of solutions that require the infrastructure of highly specialized centers. For rare procedures, particularly face transplantation, the evidence is necessarily based on a small number of cases. The book itself appropriately acknowledges that scar tissue, tissue quality, and intraoperative dissection planes may require deviation from the original plan. 3 professional lessons are particularly practical. Digital accuracy begins with high-quality imaging and segmentation, not with the printer. A virtual plan is valuable only if there is a reliable method of transferring it to the operative field. And technology should reduce uncertainty for the surgeon but must not replace an understanding of anatomy, disease biology, and intraoperative decision-making. For a dental student, the book is excellent supplementary reading but is too specialized for foundational education. For an early career or general dental practitioner, it is useful primarily for understanding the capabilities of contemporary maxillofacial surgery. The greatest benefit will be gained by residents and specialists in maxillofacial surgery, particularly those involved in reconstructive, orthognathic, craniofacial, or oncologic surgery, as well as by university educators. Does the book deserve a place in a professional library? For such a specialist, yes. For the average dentist, it is not essential. Its greatest value lies in presenting virtual planning as an entire clinical engineering system rather than as an attractive three-dimensional image. Its greatest weakness is that enthusiasm for technology occasionally exceeds the strength of comparative clinical evidence. It is best used as a specialist atlas and clinical reference guide rather than as a formal guideline. If you plan and perform complex cranio-maxillofacial procedures, this book is worth the time required to read it. If you do not perform such procedures, it is more rational to read selectively the chapters most relevant to your practice.